Having attended a first person on scene or first responder course, it's imperative that obviously we have new skills now, that we have the right equipment. To store the right equipment, we need the right bag. That bag needs to be considered as to whether we're going to be carrying on our person. Do we need to be hands-free? Have we got to operate a weapon system? Or can I carry it in my hand? Is that not so important? The equipment in your first response bag needs to be ready to hand. The best way to pack that is in accordance with the primary survey in which you learn on your first person on scene course. So thinking about D for danger, that might just be something as simple as having a pair of gloves readily available for you to use before you start treatment. Moving on from that, we're looking at catastrophic bleeding. So if a patient's got a life-threatening bleed, we need the equipment to manage that close to hand. So things like your tourniquets, your emergency bandages and your haemostatic agents need to be ready to use and ready to apply to the casualty to minimise the chance of their losing their life. So once we've managed our life-threatening bleeds, we need to move on to the patient's airway. So we're going to have a good look and obviously have suction available if that was to be required. Moving on from that, we've got our airway adjuncts. So oral pharyngeal airways, nasal pharyngeal airways, or eye gels if you've got the competence to use them. Once the patient's airways are managed, we then obviously move on to our breathing check. To manage breathing, the equipment that we might need will include a bag valve mask, an oxygen therapy mask, and obviously some oxygen. So once we've managed the patient's breathing, it may be essential or may be required that we need to use an automated external defibrillator. This also needs to be ready to hand. If the patient isn't in cardiac arrest, then we may want to continue with some patient monitoring equipment, blood pressure cuff, or just taking crude pulses. Once the patient's circulation is managed or monitored, it's important to move on to the patient's disability. Essentially, that means moving back through our AVPU scale for response. However, if we suspect that the patient may have suffered a spinal injury, kit in the bag, like a C-spine collar, will assist us in further immobilisation of that patient. Once we've assessed the patient's head around disability for head trauma, managed any C-spine injuries, it's important to move on to a full expose. That means getting down to skin level with the patient, assessing for any other injuries. To do that, we're going to need some paramedic tough cut shears. Cut through anything, get right down to skin level so you can visualise what you're dealing with. To assist us in patient management, it may well be advised to carry some SAM splints, some tape, and also a pelvic sling just in case we've got potential pelvic injuries.